This topic is systemic lupus erythematosus, also known as SLE or just lupus. We can begin to understand systemic lupus erythematosus by looking at its name. Now, the word systemic means that something is occurring throughout the entire body, and erythematosus refers to erythema, which is commonly a rash that we would find on the skin. SLE is a chronic, progressive, systemic, autoimmune inflammatory disorder, meaning that while we can treat symptoms typically progress and there is currently no cure for SLE. Just like any other autoimmune disorder, the cause is thought to be due to a combination of genetic and environmental factors. The condition of lupus begins when dead cells are broken down, which leads to the release of nuclear antigens, which are components of the nucleus found within the cells, such as DNA and other proteins. Normally, the body is able to remove these nuclear antigens without any problem. However, in the case of lupus, the body recognizes these antigens as foreign agents. In response, the body forms antigen-antibody complexes, which can deposit anywhere throughout the body and lead to the development of inflammation in various tissues and organs. We'll discuss multiple triggers for lupus on the next slide. However, it's important to note that an increase in estrogen in the body can lead to the development of lupus. Therefore, we see lupus more commonly in women than we do in men. Like other autoimmune diseases, lupus can be characterized by periods of exacerbation followed by periods of remission. What's interesting about lupus is that it has an unpredictable course and variable presentation. For example, not everyone with lupus will have the same symptoms, and symptom duration can be different from one individual to the next. In addition, some individuals may only have mild symptoms while others have very severe symptoms of lupus. Triggers include exposure to ultraviolet light, which can damage the skin cells and lead to the release of those nuclear antigens, infections, emotional and physical stress, or certain medications, which may appear similar in the body to those nuclear antigens and include oral contraceptives and sulfa drugs. Now, this slide can seem very overwhelming, especially since there's so much variability when it comes to the manifestations of lupus. Like any autoimmune disease, constitutional symptoms can occur as the body is trying to fight and get rid of the antigen-antibody complexes. The body responds like it would when it comes to fighting off an infection. Essentially, the metabolism increases to mount an immune response, and the client develops fever, fatigue, and weight loss. The most important thing to remember is that lupus can cause inflammation in any part of the body and can affect multiple organs and tissues at one time. One defining characteristic of lupus that may be different from other autoimmune diseases is the development of a malar rash, also known as a butterfly rash. And we can see this rash depicted here on this slide, and we'll discuss it further on the next slide. The client may also develop hair loss. Ulcers can occur on mucous membranes, as we will see again on a later slide. If antigen autobody complexes deposit in the brain tissue, the client may be more prone or begin to develop seizures or psychosis. These complexes also really like to deposit in serous linings throughout the body, so we might expect the client to develop pleuritis around the lungs or pericarditis, which is affecting the heart. The client can develop glomerulonephritis within the kidneys, which can lead to kidney injury. Red and white blood cells can be targeted, which can lead to the development of anemia and leukopenia. Because these complexes can cause damage to the endothelial lining within the blood vessels, clients are more at risk for developing deep vein thrombosis. And clients are more prone to getting muscle aches, as well as joint pain, swelling, and redness. So again, malar rash or butterfly rash is commonly associated with lupus and occurs due to photosensitivity to light and UV rays. It's very important to understand that UV rays can lead to lupus exacerbation due to skin cell damage. As I mentioned before, lupus can cause ulceration of mucous membranes, as we can see here from the ulcer that's on this client's soft palate. For these clients, oral care is exceedingly important to help prevent ulcer formation and prevent ulcer breakdown. When it comes to diagnosing lupus, we want to measure levels of inflammation in the body, and we do this by checking for an elevated erythrocyte sedimentation rate or elevated levels of C-reactive protein. Now, specifically with lupus, we will see an increase in the amount of antibodies within the serum, specifically anti-nuclear antibodies and anti-double-stranded DNA antibodies. These antibodies have been generated in response to those nuclear antigens that have been released from the dead cells. Because lupus can cause certain cytopenias to develop, we want to monitor the complete blood count to assess for anemia, thrombocytopenia, and leukopenia. And because these antigen-antibody complexes can interfere with normal kidney function, we want to be assessing laboratory values associated with the kidneys, such as BUN and creatinine, and performing a urinalysis to assess for the presence of abnormal proteins within the urine itself. Lupus can lead to the development of life-threatening complications, such as deep vein thrombosis or DVT, and kidney failure. If a client has manifestations of DVT, such as a unilaterally painful and swollen extremity, the nurse should anticipate administration of anticoagulants. And for manifestations of kidney failure, such as peripheral edema and low urine output, the nurse should anticipate aggressive administration of immunosuppressants. This will help to reduce inflammation within the kidney or kidneys and help to improve kidney function, which we can monitor by checking the client's BUN, creatinine, and urine protein levels. For other symptoms of acute exacerbation, the nurse can anticipate administration of glucocorticoids to help with inflammation and analgesics to help with pain. Commonly, nonsteroidal anti-inflammatory drugs are given, and oftentimes these are given at bedtime to help reduce pain overnight and improve quality of sleep. For clients who are particularly prone to frequent exacerbations and have chronic symptoms, hydroxychloroquine or other immunomodulator medications can be given to help reduce the immune response. It's important for clients who are taking hydroxychloroquine to have frequent eye examinations, as this medication can cause retinal toxicity. The client should be taught to reduce sun exposure to help limit skin damage and prevent exacerbations. Now, this is accomplished by avoiding the sun between the hours of 10 a.m. and 3 p.m. and making sure to use protective clothing as well as application of sunscreen. The use of fragrance-free lotions and mild soaps can help prevent skin irritation. Clients should avoid sources of infection, such as large crowds, not only because infection can trigger symptoms, but also because these clients are most likely going to be on immunosuppressants in the first place. Range of motion exercises and stretching after waking help to prevent joint stiffness. Spicy and citrus foods should be avoided if the client has any mouth ulcers present. The client should remain physically active. However, we should stress the importance of taking a rest between physical activity in order to reduce the amount of fatigue that the client has. Specialty makeup products have been made available to cover up skin rashes and prevent skin irritation. If the client is attempting to get pregnant, it's important that they wait until they are symptom-free for 6 months before attempting pregnancy. Miscarriage and fetal demise are more likely in clients with lupus, but especially so in those with active lupus exacerbation. Clients should avoid live attenuated vaccinations, such as intranasal flu vaccine, but should be encouraged to remain up to date on inactivated vaccinations to prevent exacerbation from infection. And stress reduction techniques, such as yoga and deep breathing exercises, can help prevent exacerbations in the future.